So hi everyone, we're going to go ahead and get started. I'm Kim Laney, I'm your OLLI coordinator, and I'm hoping right now that you can see that I have shared my screen with a welcome slide on it. I do want to welcome you all to today's brown bag presentation. We have new to Medicare, accessing our Medicare system with Ben Winker from Area 1 Agency on Aging. And thank you for being here today, Ben, and we're looking forward to your presentation. I just wanted to let you know, if you're not an OLLI member, this is there's a little bit of information here on the screen about what it means to be an OLLI member, and we are hoping to get some more members signed up for the next semester. So if you're not a member and you're interested, there's a little bit of information for you. Also, we just have lots of ways to stay connected with OLLI, and we still have a lot of classes that are happening this fall, and we are wrapping up our winter proposals, and we will be having the OLLI winter catalog out in either late December or early January, and classes will start right after Martin Luther King holiday. This presentation today is brought to you by the Friends of OLLI. Friends of OLLI are anybody who donates any money to OLLI and any amount from $1 to $5,000. So if you are not an OLLI member and you would like to donate, the link to how you donate is on the bottom of that slide. And you can also find more information on the OLLI website. Another way to stay connected is each Friday, Tracy Barnes Priestley does a discussion chat group called Let's Connect. And each week there are new topics for discussion. And you don't have to be an OLLI member. It's just a way that we want to stay connected during this challenging time. So,
and it's a lot of fun, by the way.
Thanks, Jane. Yes, I've heard really good things about the connection group. And then OLLI is celebrating 15 years of lifelong learning on the North Coast. So we have been here for 15 years. We're looking forward to the next 15. And you'll notice that lots of our classes this year are being offered for $15. And that's because the instructors are sharing or celebrating with us and offering their classes at that very low rate. The best way to contact OLLI is via email. But we will accept phone calls. It's just there's no one there in the office to pick them up. So hopefully I've answered any questions you might have about what's going on with OLLI right now. As far as Zoom today, if you have questions, you can put those in the chat. Ben has indicated that he will take periodic breaks to ask for questions. And so at that time, you can ask your questions as well. I will ask you to go ahead and mute yourself at this time because Zoom does work best with only one person speaking at a time. And I will, if I don't see you muted, I will mute you, and but you will always be able to unmute yourself if you have a question. I think that's everything I have for now. I'm going to go ahead and turn it over to Jane so she can introduce our presenter today. So thanks everyone. I hope you enjoy the presentation. Thanks for being here and staying connected with OLLI.
And I'm delighted to introduce Ben Winker, who is the manager of the Health Insurance Advocacy and Counseling Program, HICAP, and a state of California registered counselor for Medicare insurance. And Ben has been with A1AA for some time now. In fact, I just happened to catch him being interviewed last night on Access Humboldt. So not having seen him before and only coming in partway through, I figured that's who I was going to be meeting today. So welcome, Ben. Happy to see you, and on we go. Thanks for doing this.
Well, yes, thanks, Jane. Thanks, Kimberly, for all your support and help getting this started. This is my first presentation of the year, of the most exciting and trying year I've ever experienced in my existence so far. And, you know, I'm so glad we can let go of our masks. I'm glad Halloween's over. I'm glad we're where we're at today. If I could throw out one piece of information to Kim, my mom's trying to get on Rosemary Talamontes. So if you see her, let her in. Thanks.
Got it.
So anyways, I will start with, I work for the Area 1 Agency on Aging. Many of you, I'm sure, are aware of the programs we cover, but I do want to go over them really quickly. HICAP, which Jane introduces, Health Insurance Counseling and Advocacy Program. It's free, non-biased Medicare counseling and consulting for beneficiaries and family caregivers. So just about anyone can call and ask for help about Medicare. Assistance with prescription drugs, supplemental plan information, and Medicare issues. So concerns, billing issues, appeals, just trying to understand the program. We also have a wonderful information and assistance program in our office, and it helps seniors and community find resources, community resources, and publishes the senior information guide, which I hope you all pick up and share and pass out. We also have the long-term ombudsman program, and they advocate for residents of nursing homes, residential care facilities by investigating grievances, addressing resident concerns, and resolving problems. The North Coast Home Share, I definitely want to share that program. We're providing tools and resources to support older persons in sharing their homes with a compatible housemate in exchange for rent, services, or both. So if you have an extra room or two, or an extra room that you're considering or needing to rent, working with us, we help vet those people. We interview those people. We find those people. They put it out there. Other people with homes put it out there. And we kind of tie them together. It's working really great. And I think we're up to almost a dozen. We also have our stay put and fall prevention services. So how can we come in and do some updates, upgrades, handrails, other things, see what we can do to help make the home safe. So as we age, we can age safely and be considerate of ourselves and our family members that may visit us. So it's a wonderful program. The fall prevention program is really just ramping up. So stay tuned and stay put for that. Of course, we have our staying active and independent life program, which is exercise, evidence-based fall prevention, strength and balance exercise classes led by trained volunteers and offered throughout Humboldt County. As we know, we're all not getting to the gym, not getting out enough. A lot of us are living behind screens, and it'd be an important thing to join a group to exercise, stretch, and consider your body, the temple, as an important part of considering yourself first before you can help others. We also have the Volunteer Center of the Redwoods still, which encourages people of all ages to volunteer with agencies and services that support older adults. And the Volunteer Driver Program, which we provide local and non-emergency medical transport to eligible clients. One of the most important things, in a way we can figure out how and what we need in our community, is we have a planning and service contracting group, and they produce the 4-year area plan for Humboldt and Del Norte counties and gathers information to develop innovative solutions to address emerging needs, and allocates federal and state funds to provide senior nutrition, family caregiver support, and senior legal services. So we send out a survey and really find out what the community needs. We're working internally right now on unmet transit needs for our aging population. It could be 50 to 100, but it also could be the rest of the community. And how do we get the buses and the shuttles and everything tied together so we can put together a good knit and get places we need to get. So that's the Area 1 Agency on Aging summarized quickly, which is a wonderful program. I'm so proud to be here and be able to present really a new to Medicare. It might be redundant to some of you, but it might put some questions in your minds and give you some thoughts to dive deeper into as we go along. So I'll cover 3 basic information sheets and then ask for questions and then move forward. I'm going to attempt to share my screen. And here goes. There we go. So I'm hoping we all see new to Medicare checklist. Is that correct? New to Medicare. Okay.
Yes.
Perfect. So, as you all know, Medicare can be a daunting, growing experience for all of us. And at 65, you're asked to develop a comprehension level of healthcare that's really unthought of during most of our adult lives. We're working and we have insurance, and then we're going to move on to Medicare. So enrolling in original Medicare, of course, you can see you might be receiving Social Security or retirement check. You might get it before, you might be asking for benefits before. And there's the information to call the Social Security office, set up an account and enroll. You can also enroll in it online after setting up a Social Security account. basically, and we can help with that, as the occasions arise and kind of give you the next steps and the directions to take those next steps. Medicare Part A, I'm going to go into it deeper, but it's hospitals, the Medicare Part A. If you've worked your 40 quarters or 10 years, you're going to get Medicare Part A for free. If you worked less than that, or if you never really if you worked even as a teacher and you never paid into Social Security, there's different insurances that are going to cover you in different ways. And I'll get into the pricing if you didn't work the full 10 years or 40 quarters in a bit. You can see it's no cost if you've worked those quarters. Medicare Part B, it does have a monthly premium. This current year, it's about $144.50. I believe it's going to be $148.50 in the coming year. So you can just round it up to $150 when you're thinking about how it compares to other programs. If you're offered a group employee healthcare program or a retirement healthcare program, you might decline Part B and accept that if the total cost of that is less than original Medicare. And we'll kind of get into the cost of that in a little bit as well. As you can read, the 20% co-insurance for covered services, and we'll get into that in a little bit as well. And you can delay, as I said, if you currently have working insurance and it's covering you with credible coverage. But if you don't have credible coverage, or you're leaving your job, or you just never thought to pick it up as soon as possible, as you may incur some penalties that may run with you for the rest of your life. So it's important to check in with HICAP or really investigate what it's going to pay for. This lengthy Medicare Part C Advantage plans, they are something that's not included in Humboldt County, Delaware County, and 7 other counties in the state of California. For one, maybe the populations are small, the hospitals are small, maybe they're small rural clinics, so they don't participate in this. So the big companies, insurance companies, they don't see the benefit at this point in covering us up here. The biggest thing I can answer right now is all the commercials that you might see on TV up here really don't apply. Joe Namath, his programs don't really count for what we have up here. You'll see them say, we have transportation opportunities, we have drug care help, we can send you food, I can do all this for you. And I'm Joe Namath, you want to believe in me? And people look to him as a leader, for many years. And I think Wilford Brimley, before he passed, unfortunately, I think he was on there. Besides oatmeal, he was slinging Medicare Advantage programs. But let's just not go into that because it's not available. Medicare Part D, we will get into in a little bit. As you can see, they're separate parts. So Medicare A, or Part A is hospitals, Part B is doctors, and then Part D is prescription drugs or drugs. That's the best euphemism you can say. There's the website. I believe it's, once Kim shares this to our presentation, you can probably link right to it. And it's a great website. I encourage you, and I'll talk about this later, to set up a MyMedicare account online if you have access to the internet. It gives you a lot of resources. It shows what plans you're in. It helps a lot. I'll get into it a little further. And of course, the all-important number of Medicare, 1-800-633-4227 or 1-800-Medicare if you've got letters on your phone. They, of course, we'd love to help first. This time of year, we're swamped with the open enrollment, situation. So if in all questions or, you can't get through to us, which I hope that doesn't ever happen, please go ahead and just call them. Things we'll get into a little bit soon is the premium, deductibles, copays, all the part of Part D prescription plan. And then, of course, open enrollment, which this is why you're seeing those commercials, because Medicare Advantage can change plans right now. And but we can change prescription drug plans. And so we would love for everyone to review that. You can review that on MyMedicare.gov website, or call the 800 number. But premiums do change. And so we'll get into that in a little bit. But it's important to consider it. And of course, as you read, and I'm sorry my mouse is all over it, I'll try to get out of the way. But of course, it might have conflict. So call us if you have questions about it. If you're working or have a retirement plan and you're not sure if you want to give that up to go to original Medicare, our counselors are filled with knowledge. The longest serving counselor, 15 years, waiting for a pin to give him. We have a counselor that has hit the 10-year and the 5-year, and we have lots in between. I cannot be prouder and more excited to work with them. They give me so much knowledge, and they're ready to share that with anyone who calls. You know, and so I think they're just a wealth of knowledge, and I'm learning so much from them and from all the other ways I'm learning through this. So you see, that's what I was talking about. There, of course, is Medicare savings plans, extra help, low-income subsidies. A lot of them are eligible at income, but it's really growing in the federal poverty level. So some of the programs are 138% of federal poverty. Some of them have different asset levels and limits. And so if you have questions, call us. We'd love to work with it through it with you. So even if you're wondering, you can always ask. We'd love to help you out, just period. So don't worry about, there are no silly questions in Medicare. There are only questions that you might not know of yet, and then once you know, you can share the information. Time frames, which is really important. The initial period, enrollment period, and this is so important. You are maybe within, that Medicare age group, but a lot of you may not be. But if you have family members moving into it, the 3 months before your birth month is the most crucial time to get signed up. Then it starts on your birth month. I think it's wonderful to see that you did that. If you started afterwards, it's going to postpone it. If you started on your birth month, it's going to postpone it for 1 month. If you started the second month, it's going to postpone it 2 months, potentially 3 months. So you want that seamless shift from other insurance to Medicare on your birth month. So reach out to us 3 months prior. That's the most important piece of that. And then general enrollment. If you missed that first year, or you just didn't know, or you were scared that's going to cost too much, you're definitely going to want to reach out to us the following January 1st through March 31st, because we can get you signed up. But then it's effective, you can see later in July. So you really, again, the first month of your 3 months prior, give us a call earlier, tell anyone and everyone. Of course, Medicare Part C doesn't occur here. And prescription drug, what we're going to advertise, what we're going to share, what we're going to be excited about is our open enrollment, fall open enrollment. The thing we're going to talk about, hopefully, in more advertising, more online, more on TV this coming year, October 15th through December 7th. And then there's special enrollment periods. If you leave a job, you have a special enrollment period. If you decide to give up your retirement plan, you have a special enrollment period. So before you give up any plans or you make those changes verbally to them, call us, reach out to us. I'll have the contact information, but of course, you might already know 444-3000 area code 707, or the general number 1-800-434-022 is another 800 number for us. And you can see all that information at the bottom. Yep, there it is. And our office is closed, unfortunately. It's been closed since March 15th. We shut down literally the day after our volunteer engagement party, and with the whole county had already been shutting down. So we've been doing phone appointments. We're slowly growing into Zoom and Google Meets and other types of appointments where we're able to share screens. And so let's see. So we're excited about that. That's the general overview and time periods. Some great guidelines about what Medicare is. I'm going to close this. No, stop sharing. I'm going to go to my next screen. So I'm going to just minimize that. I'm going to go to the A and B's of, let's see if I've got it. Did I open it? I'm sorry, it's giving me just a second.
Hey, Ben, while you're doing that, just so you know, I did put the new to Medicare checklist in the chat. So
Okay.
people all have access to that.
Perfect, thank you.
And if it's late, I'll add it again at the end.
Okay, and then I apologize. I am going to try and flip this.
Yeah, you'll need to do a screen share again. You're not sharing.
Oh, okay. I'm not sharing it yet. Okay. screen share. This one, share. I move this over here.
Oh, look sideways.
So, shoot.
It's okay.
I want to. I am not sure about this. Well, I'm going to do my best. And so this is, I apologize for the view. But of course, I'm going to I apologize if you have any neck issues after this. I'll try and get through this one quick and then move to the second one. And I've kind of covered this already. But original Medicare is Part A, as you can see in the upper right corner. The hospitalization, skilled nursing, home health, and hospice care. Part B, physicians, diagnostic equipment, outpatient and lab services. So if you get any prescription drugs or a flu shot or some kind of a, anything, something in the hospital, they give it to you, that's covered by B. So anything that won't be in your D program. So that's a neat thing. Part D, prescription plans run by insurance companies, and they're based on personal prescription history, and they have copays and monthly premiums. Of course, the annual enrollment I went over. Part C, you can ignore. Part D, or the other fourth parts of our original Medicare, and again, I'm sorry about this sideways, but it's supplemental or Medigap programs, and they coordinate with what's missing. Medicare covers 80%, which we'll get into. Supplementals will pay the other 20%. And then you decide if you need them based on if you have current coverage or not. So I'm going to stop sharing this one and move into, go ahead, Kim.
I was just going to ask, is that the same sheet as the one that's got it all in color?
Yeah.
Okay, I can share. Let me share it really quick so that
Would
people
you?
can see.
Thanks. I'm going to close this one.
So is that the right one? Can you all see that?
Yeah. Thank you, Kim.
Sure.
Working on it.
Yeah, we'll get there. It's no worries. So does everyone see that? And that's what you wanted people to see, right?
Correct. Thank you. And then I am going to minimize this one. Now I'm going to share another screen. Let me find. So let me share screen. Here we go. So share. Do you all see this one, the 2020 Medicare benefits? Sweet. Thank you. Thank you. Thank you all. Let me minimize this one. Okay. So this is the important part. I think this is good to see. So right now, these have gone up a little bit, and I didn't update this 2020 Medicare benefits, and I apologize. This past few weeks have been incredibly busy, and so, but anyways, you can see that if you did the 40 quarters, it's free. If you did a little less, you're going to pay a premium per month for Part A. So hopefully you saved well, or you have something to help cover that, be it some other insurance program. If you did work a lot, if you were 29 quarters or less, you're going to pay quite a bit for Part A because you didn't pay into Social Security. But as you see moving through, the services, hospitalization, private room, you can read that. This is the gap. This is what, Medicare will pay 80% if you go into the hospital, but you're going to pay the $1,408 if you go into the hospital. And that's for the first 60 days. Of course, you can see it go up at the next window of days and up further window of days. Beyond 150 days, you can see it goes up quite a bit. And then once you're past that, it goes up considerably. It's very similar to the other psychiatric hospital, skilled nursing facility. If you were admitted to the hospital for some break or some injury, the most important question, or one of the most important questions, is how am I doing? The second most important question is, am I admitted? Am I being truly admitted to a hospital? Because if you're admitted for 3 days, then you go into the skilled nursing facility, you'll pay nothing for the first 20 days. After that, you'll pay $176 per day. And after that, you're going to pay, after 100 days, you'll pay at all costs. Most people don't want to be in a skilled nursing facility for very long. So your best bet is to do the work and push yourself and be strong and get out of there. But that's really important to know you're admitted. So that's covered for the first 20 days. Right here, the 20% is for home health care. So if you need covered medical equipment, we really don't have in Medicare an in-home health services program. There's not a lot of programs that will come help you in the home, move about, do anything helpful, really. If you get if you're low income, or you can apply for extra help or low income subsidies, sometimes Medi-Cal will come in and kick in and help you out in-home health. But there's limits to that with income and assets. So, and if your cars are pretty old, you'll be remarkably happy to hear they don't really count certain vehicles, no matter how well you've taken care of, very highly. An example is a person has this really nice Toyota Raider from 1982, and they valued it at, Medi-Cal valued it at $350. But for this person, they valued it as the world. You know, it was world traveling and here and there, and a second home if you ever become challenged. And so to them, it was priceless. But for Medi-Cal, $350. So, you know, don't look at Blue Book value. Really ask Medicare what they consider it. Home health care, Medicare pays 80%, all but 20%. And so you pay that 20%. Hospice, once you get into that, you can see the $5 copays. Blood, you know, you've put in your blood, sweat, and tears, so you're still going to pay for the 3 pints. So hopefully you put in enough to get it back, and they'll pitch in after that. But I kind of laugh at that. Medicare monthly Part B insurance, and this is medical, not Medi-Cal, but medical insurance like doctor visits and such. And then you can see the monthly premium. I'm working on updating that. That's going to be 148, I think 50 cents, 48.50 for Part B, and that's every month. That's just what you pay as the premium to have Part B. It's important to pay that. If you pay it through your Social Security, I really applaud you. I think it's the simplest way. Of course, your choice is your choice. I'm not going to direct you. I just think it's easy. You're not going to forget. As long as you get your Social Security, you'll pay for it. If you consider wanting to pay the bill, you're on top of it, you really like sending checks out or paying it, go for it. I appreciate that too. But the simplicity of it, I believe, is the win for everybody. So that's my opinion and personal advice. So take with a grain of salt. If you pay your bills and you're on time and you're never going to be late, I applaud you and all the people like that. I unfortunately work on that every month, so that's not the best always for me. Of course, you can see it right there. You're reading it. You're going to pay. These are the gaps, the meta gaps, the supplemental insurance you might look to purchase to cover this. And we'll get into that a little further as well. You get a Medicare and you book in the beginning. I don't believe they send it to you every year, but you can always call Medicare directly and ask for a book to be sent to you. And please first ask us at HICAP, because I order 50 to 60 per year and we don't run out of it often. So I'd be happy to meet you at the back door, hand you the updated one, and we can talk about it over the phone or in a Google Meet appointment if you need further clarification. And of course, call HICAP for an appointment, and we'd love to go over any part of it one-on-one with you. Let me see. I'm going to go let that one go. I'm going to close that one. And so I'm going to break for a second and ask for questions. Did anything come up in the chat room, Kim?
There were a few questions, but Erica, thank you, has been really building those questions.
Oh, good. Erica, Jack? Mm-hmm. Oh, wonderful. I'm so glad. That's wonderful. Thanks for your help, Erica. So yeah, perfect. So I'm so glad you're being able to share those other exciting programs of Area 1 Agency on Aging, because we we're kind of always working on our needs and trying to figure out what the next steps are for us to be able to be most helpful. So that then
Real quick, Ben, hold on. There is a question that just came up. How does long-term care insurance fit in with Medicare?
Unfortunately, I don't see it. It's a real challenge. A lot of people got that in the beginning of the offerings, and it did. The value is what it is. A lot of people do it, invested quite a bit. Might see a year's worth of help, a year and a half worth of help, but the premiums go up every month. The long-term care insurance that I hear about and read about, I believe there's one left out of all of them. So if you have them, they might have their promise to you. If you stop paying the premium, they might hold that pot of money and still pay out, but they won't grow it. So you can literally stop sending them money. It sits there till you need it. It's a third of it's really not as beneficial as I think everyone hopes. So it's unfortunately, I don't see the huge benefit in starting one anymore. If you have it, it might not be worth it to keep investing in it, but use it as that resource when that comes about. It'll help with a third of a residential living facility for a year and a half. You're still going to pay $200. They're going to pay $100. So it eases that burden. But I don't see the value that it once potentially had. Now, again, that's our view. That's my view of it, my opinion of it. It's not going to pay 100%, and the premiums are going up exorbitantly as those companies literally go out of business. So I think there's one left, Gem Life, or I won't get into that is still kind of working the end of their program life. So I don't see any more coming. So definitely reach out to them. Definitely reach out to us. Let us consider what that value is with you, and then see if that's the benefit to you that you still hold it as. But honestly, I don't have much high opinion of those anymore. Please call us and we'll set up an appointment. Of course, we're super slammed at the moment. So most of this hopefully can wait till December 8th, 9th, 10th, and after that, and we can really have some time to spend with you. But reach out to us at the 707-444-3000. Or if you have other family members in other parts of the state, the 1-800-Medicare number will, if they call that, they'll get led right into their local HICAP office. It actually directs them to that. So I would ask further questions to HICAP, and then have any family members in other areas reach out to their local HICAP groups, and they're throughout the whole state of California. We have 33 different groups that I work with strategically regularly. So they're a huge group, and they're wonderful. So I'd reach out to them as well if you have any family members out of the area. Any other questions, Kim?
Yeah, there's one more question. It says, I got lost on the Social Security quarters. I was a teacher through Eureka City Schools for my career, Eureka County Schools. I do not collect Social Security. Does that change anything that you've discussed?
Definitely. You need to definitely, if you're 65 or older, regardless, I believe you really need to pick up. So here's the thing. If you have insurance through your school program, that's generally going to cover you Part B, D, and act as a supplement. You still need to get Part A at 65, but you call us and let's talk about it, be it over the phone or maybe we can make the next step as an appointment. If you leave, so that is your essentially insurance, is that program. So you're going to want to talk to that former HR department or their HR department, or somebody might know it, find out what it covers and when things end or start, and then coordinate that with other parts of Medicare. So it's kind of a coordination of it. There might be other people in this group that could raise their hands and talk to it, because I know so many people in this area are teachers or were former teachers. But HR of the former school, or Humboldt County Office of Education, and then call us again to help fill in those blanks, because it depends on where you're at. If you did pick up Part A, if you do, you need Part B, or does that act as credible coverage? So whenever that might end, then you have a special enrollment period to pick up the rest of Medicare, leave that one, but you might not. It might be worth it, and value-wise, economically wise, which costs more and what covers more. So you're comparing two different apples, but it might be a Honey Crisp and a Granny Smith. They might both be green or have a tinge of blush, but they might be different. So I hope to answer your question. My main goal is to just help you call out to our program and then go further at a later period. So feel free, of course, to leave me a message. My phone's on Do Not Disturb right now, so don't hesitate to leave a message as soon as we're done. Thanks for the question.
And then real quick, it asks, how do you determine how many quarters?
Call Medicare itself. Call Social Security itself. That number's, you can call the local numbers 1-866-828-1991. 1991. That was the start of my second year in Humboldt County. So it's a remarkable year for me. I hope it's a remarkable year for you. That's the local office number. They're so wonderful. They have a community engagement person, and they're really trying their best to meet the needs. They, of course, are doing phone appointments as well. We did get an announcement saying limited office appointments. You'll need to go through their phone number for them to consider any of that. I don't believe they'll open their door. So don't go down there without checking in first. But that's the best way, and that's the most straightforward way. Social Security, call them first, because you might figure out, oh, you're really close. If you're retired or close to retirement, you might find a job or something that might kick in some quarters for you. Some people find super encouraging ability to drive a bus. Don't, all this is with a grain of salt. So find your way back into the system if you need further quarters, but don't hesitate to reach out to us. Any other questions? Okay. So I'm going to do a language first. My break, my happy break. I hope you all have fun with this just for a second. The last pair of scissors that were in my desk that I took over from the former program manager, who was most wonderful, Nancy Cloward. I appreciated all her help and direction and guidance my first year up here. And then she let me loose January 1st, 2020. And it's been an interesting ride, but I just wanted to share this. I thought it was funny, and I'm glad that people are doing this. And I want us to all encourage us to learn languages, to share, be open to sharing what we know, to reach out to people we might not speak the same language. Say hello. I look forward to friends. So the first one is sisu and tijeras is scissors. So if I mispronounced it, feel free to correct me. But I just thought that was great. And I'm glad they're reaching out that way. And I hope that was clear. Was that clear enough? That was clear enough? Okay. Semi-clear. Okay. So sisu, scissors, or tijeras, scissors. So that's one of my things. I have another joke for later, so we'll let that go. I just wanted to move forward in a great way. So I'm going to share another slide. And please, we'll take a break after the supplemental insurance piece for another quick check-in. So I'm going to share, okay. So this is, sorry, let me click this over. Oh, I lost it.
Yeah, I don't think.
Okay, here we go.
Okay, there you go.
Sorry about that. So Part A and Part B have those 80% meta gaps, or gaps. Those pieces cover 80%. What we're looking for, a lot of people look for, is a 20% supplemental insurance that might cover the rest of it. So if you can see my California birthday rule replacement Medigap plans, this is from the California Health Advocates. You can see at the top left corner of the sheet. They are a great group of people that do a lot of information sheets. They have a lot of wealth of information. So I encourage you all to go to that website. At the bottom, you'll see a blue link. Once we share that with you, I hope that'll just direct you right to it. Otherwise, just type it in California Health Advocates in the search bar. whatever search bar you use, and you'll get right to them. So of course, it's got the plans, but the first thing, the greatest thing is the past few years, California has been lucky and wonderful enough to offer a California birthday rule. And it's a guaranteed right to review and change your supplemental plan without health screenings, without chance of denial. So you won't be kicked off of it. You won't lose it. You won't be questioned about pre-existing health care. This is where pre-existing health care comes in for us in Medicare when we're talking about Medicare. So it used to be 30 days after your birth date. So if your birth date, for example, was the 15th of October, you'd have 30 days. Now you have 60 days, 2 months. So it's really increased that window twice. So you can investigate, look into, call your agents, see what other plans they might sell. Some agents only work with some plans. Some insurance companies only sell certain insurance. And I'll show you a piece of that in a second with the second slide. But so as you can see here, A is going to cover all these 20% gaps. So it's not the best way to show it, but you can see, for example, A is going to only cover the Plan A parts, which is of the hospital part. The Plan B, these plans A and B are going to cover those. Plan F, which was available the past few years, and many of you might have it, was available until 2019, and it covered everything you can see. Plan G covers just about everything except for the 198 Part B premium. So that's a good one. This doesn't show it super well, but we have other sheets we'd love to share with you that would show you what we cover. And so some plans are going away. There's high deductibles where you pay a low premium to access them. You can see if you had for example, you were lucky, you were enrolled in a Plan F prior to 2019, and you wanted to change. You could change to a Plan F, I believe, high deductible. It's going to cover all the gaps, but you're going to pay a lot less in premium. But when you use it, you're going to pay $2,300, a little plus. So you're going to pay a high payment at the end if you have to use it. If you're healthy, you're strong, you figure you don't need it, you're gamble, you have enough in the bank by saving that money from the higher paying plans. You do your math and you figure, well, I saved $2,000 already by not having a Plan F. Then you're close. You might be saying, well, it's going to cost me $300, but you have to remember you have to put that money away. If you don't have it, you're going to have a slight in debt. So you want to play if you're a gambler, you can play the game. If you're not, you might not want to go with the high deductible. Or if you feel like something could happen, I don't want to, see the future, but if you just want to gamble with that. So please call us again and again. I'm going to reiterate that we'll be able to go in a little deeper. So then, of course, this is the small print. It's going to be available for you to go through. I'm not going to cover this at this point because it would take too long, and it's the fine print. But it's there for you to download, to save, to share. Any kind of opportunities there. So I'm going to stop sharing that. I'm going to go back here. Okay. Okay, that, okay. I'm going to share another page, and that is this page. All right. So, okay. So I'm going to enlarge it for us to all see. Okay, wonderful. So, one second. So this is the California Department of Insurance information. And so they're the state agency, the Department of Insurance, that goes through, evaluates, excuse me. I should have had a sucker. They go through and kind of investigate what all the bigger insurance agencies cover, and then who sells what. They put together this list, and it's available right there in the California Department of Insurance website. And you can see the different plans and what they cover. So again, that other sheet kind of did it sideways. This one I think is a little bit more expressive of what some of the insurance companies cover. And then if you have a local agent, locally, sells you homeowners insurance or a life insurance policy or renter's insurance policy or any type of policy, earthquake policy, um, they might sell some of these plans. So if you see that you have one of these plans, you can see that they'll cover all these. They don't cover D, high F in this first plan, AARP, or M, but they cover all the rest. Some of them only sell a few of them. Some of them sell quite a bit. And they update that regularly. And I need to update this again because it does change. But generally, oh my goodness. I'm going to work, there it is. So, so there you go, sorry. And so you can see they cover certain ones. As I said, here's Plan F. Here's Plan F. All these companies cover it. But unfortunately, 2020, it's not available. So a lot of people might choose Plan G, which is really the next step from Plan F. But there's all kinds of reasons to choose different plans, from the pricing, your personal situation, what you foresee in your life by travels, by other things. So it's good to dive a little further in with a counselor. And this is a State Department website, so it covers all of these. And of course, we say we're covered under the SHIP grant. That's us. Everywhere else in the country, it's a SHIP program. Here, it's the HICAP program, Health Insurance Counseling and Advocacy Program. SHIP is the State Health Insurance Program, or help for that. And so that helps with the grants and helps support us. And that's how we get a lot of this information and what support us in a lot of the information we're able to share with everybody. So you can see some programs don't sell very many and some programs sell a lot. So we could share this with you. We do have a local sheet, but I don't want to really share that right now because it hasn't been updated and it needs to be, we need to do another call out. I'm going to put up I'm going to share a different screen. Okay, sharing one more screen. So we definitely would love your, your help when you get near your birthday month. So a lot of people might call us 2 weeks before their birth date or their birth week. It doesn't really matter. Please don't ever share personal information over the phone. We don't need to know your birth date, social security number, any of those things. We don't want you to share that over our phones. That's all confidential information. If we're talking, that's one thing. Our phones are, of course, secure in our offices, but it's not necessary to share that with anybody unless you're talking to Social Security or Medicare directly. I'd be hesitant to take any phone call and share any of that information. And if any group, anybody calls you and is fishing for that information or looking for that, we participate with the Senior Medicare Patrol. We're liaisons to that program. So we would take that information from you, what they told you, not what you gave them. You could tell us I was unfortunate to give them my Medicare number. Now I don't want all these knee braces that they're charging me $5,000 for. There's a lot of scams with back braces, knee braces. Screen your calls. Screen your calls. If they don't leave a message, they weren't real. Block that call in the future. So I would suggest that. But once you get to your birth month, you got 60 days. Birth date, you got 60 days. So you've got some time if you talk to us. We'll share further information. And I don't have the website up, but we use a commercial website. Of course, I'm not recommending you use them instead of anyone else. I'm not encouraging you to use that instead of a local insurance agency, because you might have a local insurance agent and you want to keep that money local. But ehealthinsurance.com, one word, it's a great resource to get a general estimate. There's a bunch of insurance companies. Therefore, I'm not sharing just one to direct you to that. I'm sharing more than 3. So it's up to you. They have licensed agents, but again, it's up to you. I don't want to discourage you from using local agents, but you can put in your circumstances. You can You can click filter by your plans, consider what you might be taking in the future, consider other plans that you might have heard about, and kind of filter and compare. And it's a commercial website, but they offer many different group plans to start you off. And I think it's a good resource. Again, it's commercial, so it's market based. And then the caveat to this whole conversation about supplemental insurance plans, we might identify with you a plan that's going to best serve you, but we are not licensed insurance agents. We would not sign you up for a plan. I would not encourage any of my counselors to tell you this plan's the best, pick this plan. It's honestly, all of these things are suggestions, advice. We'll help you a lot of times to the water trough, but we won't help you drink. We'll help you to the door, but you have to invite that vampire in. So you make those choices. It's not us to choose for you. We're here to advise and consult. So please remember that for any of our conversations. And then if you ever find somebody directing you, please call back and talk to me directly. Ben Winker, extension 2222. So feel free to use that when it's the next level and you feel concerned. But otherwise, our counselors are fantastic. I don't want to dissuade you from them. Just know that this is a free market-based choice. This is outside our realm of sales. We don't do sales, but insurance agents would love to sell to you. So talk to them or use the Department of Insurance and talk to them and see what they say and then work through it. And we'd love to help you compare, but then it's up to you. So moving on from that, I got one quick.
And real quick before we go
yeah,
on, what was that website again? Could you repeat that?
So it is a commercial website, but it's ehealthinsurance.com. So that's always something to remember. .coms are commercial. They're going to try to sell you something. They're going to sell you information. They're going to give you information to eventually sell you something. .gov is a government website. I think safer than most, and it's mostly vetted millions of times by millions of people before it even gets somewhere where you can access it. .org is generally moving towards nonprofits and organizations that are trying to help demographics throughout our demographics, from be they youth to middle to older to different groups. So they're going to have all kinds of help for you in different directions. A1AA.org, Area 1 Agency on Aging.org. We're a nonprofit organization working with grants from different bigger groups. And so we're happy to help and share that information. But that's one that we sometimes use to start that conversation because it's really people friendly. I'll leave it at that. I'm probably going over on everything. So the last resource I'd like to share is resources for Medicare. So we can email you this. You can, reach out to us. The HICAP, it's at the end of this, and I'll have it in a second. But these are all resources we have and we can share with you. And I'm sure Erica, who's a part of it, who helps run the information and assistance program, would probably have this as well. But here's the Social Security Administration again, Medicare office, government website. These are right there, links. Hopefully these will be linkable. You'll be able to hover over any blue one. They're not linked in this page, but over when you see a website in blue, generally you can hit it and go right to it. Here's the California Department of Aging. Here's that website. I'm sorry, for the California Health Advocates. Here's the Department of Insurance website, .gov. You can see that. There's a .org. They're a nonprofit group working with grants to support and give you this information. SMP, if you ever feel like you've been frauded or scammed, or you're just concerned about something that feels funky or amiss, feel free to reach out to us. We're going to refer you to the SMP group of people and our local liaisons. Since we're liaisons, we'd love to hear about it first so I can share it internally, and then I'll share it with them. Area 1 Agency on Aging, There we go. You can reach out to our website and you can find HICAP, and through that you can send us an email. This is our agency phone number. Needy Meds is an org, not .gov, .org, which is a nonprofit trying to help you find help with prescriptions. Participation for prescription assistance. A lot of prescription drugs will have a program, assistance program will help you if you're low income. Disability benefits, California State Automated Welfare, Department of Health and Human Services. This is our local group. And then that's it. So I am at one more, I'm at a couple questions. Is there any questions coming in right here?
There are a couple questions in the chat.
Okay.
Let me go back a little bit.
Okay.
There definitely are some questions on the different plans. I've only heard of plans A, B, C, and D. What are plans F through N? And then also, did I miss something? Are you saying that plan F is no longer available after 20?
Okay, those two questions. Okay, if I might have misspoke. Okay, with original Medicare, there's parts. Now, this is the most common misconception is there's all these numbered parts. In Medicare, there's a part A, hospitals again, part B, diagnostics or doctors, medical going into the doctor's office, part D, your prescription drug plan, and then supplementals or Medigaps. That's it for parts. What I was talking about is plans. So plans A, B, C, D, F, G, up to N. So those are plans. Those have to do with the Medigaps. Within, it's the drop-down window, drop-down library within Medigaps. So you're going to see Medigaps, you're going to have a line, and it's all those plans below that. Part A, Part B, Part D, they're all parts of the original Medicare. Part supplements right in there, in between parts B and D, or after D, whatever you consider ordered. And then those plans are layered under parts. You know, it's what it is. I'll leave it at that. Plan F retired itself. The government retired it. The government, the powers that be, decided that you needed to get some skin in the game. They wanted some of your blood. They wanted some of your money, essentially. So they retired 2019 for anybody turning 65 in 2020. Everybody who has Plan F, supplemental Medigap plan, can keep it. They're grandparented in, they're grandmothered in, they're grandfathered in, they're grandparented in for the rest of your lives. If you don't, if you let it go, you'll never get it back. Or I believe you can get it back, but people might not want to do that. The bigger question is, if you picked Plan G price-wise, would that save you more than $200 per year? If it saves you more than $200, it saves you $250. Then and you bank that money. I mean, here's the thing: if you negotiate or do your gamble that you're not going to pay that money, save that money, please, because if you get hit with it hard later, you're going to be paying that for a little bit. But if you can see yourself saving that money and it saves you more than $200, you might as well change and then consider that. So those are considerations that our counselors one-on-one would love to go over with you and kind of talk about the gamble, the situations that might change, what that means in that prospect. Anything else? And if I'm reading this right, can you actually get Plan E locally if you didn't have it before 2020? No. Well, if you're 65 in 2019, yes, you can go back. So, reach out to us, or you have an agent, call them and ask. A lot of agents aren't up as aware as maybe we are, but a lot of times they're just as aware because they're ready to sell you something. So talk to your local agent or start with the HICAP program. We'd love to help there. We good? Okay. I have two jokes before we go into a short a Medicare Part D PowerPoint that I helped put together. So, so becoming a Medicare program manager, I've gotten a lot of skills, and one of the skills I've gotten is I've become very psychic. So I can tell all of you, where you got your shoes, any one of you. So, if I was to ask that, and you might think to yourself, how do you know, where you got my shoes? Kim can ask you, I'll ask you this question just to start. Um, so, I became so I can tell you where you got where did you get your shoes?
You want to know where I got my shoes? DSW.
Well, I knew before that and after that, and that's a great answer. But I thought your shoes were on your feet.
Uh-huh.
That's I'm trying to go kid friendly. I have nieces and nephews, and then this one might be better. I'm just going to answer this rather than ask anyone in particular. What key does a piano play when you push it down a mine shaft? We'll give it a pause of 3 seconds. What key does your piano play when you push it down a mine shaft? A flat minor.
Oh, goodness.
I know. I'm looking for happiness, and I've had some happiness in the past few days, but I need to get past that and get onto something, open to interpretation. So we'll take that as a grain of salt, and I'm going to share one more screen with you all, and I'm going to go through this relatively quickly so we can get to some questions. But you just tell me to slow down, please. So let's see if I can find it. Where's my sheet? There we go. Oh wait, I have to open it up. So let me open it up and let me see if I can get that. Cancel. I'm going to share a screen. Here we go there. I'm going to share. Okay. Let's see if I can do a slideshow. All right. I hope you all see this.
Perfect.
Okay. Thanks. Okay. So you can see my little tagline for the State Health Insurance Assistance Program, which we're under as the HICAP program. You can see our overarching agency up here. And this is about prescription drug plans. I'm going to move through it. Some of you have already, of course, received your new Medicare card, and it should look like this. We're hoping that you've retired your old Medicare card with your Social Security number on it, and that's the most important thing. Is if you have an old one, you need to retire that. Call Social Security, call Medicare at the 1-800-633-4227 and request a new card. You can also go to .gov, the government website, and create an account and request it through that. Beware of scammers. Again, I pointed out we're a part of Senior Medicare Patrol. They're not sending out new plastic cards. Don't ever answer if somebody's calling to send you a card. That's a scam. Tell us. Save the phone number, save the name of the person trying to help you with it, and we're liaisons, so we'll help where you need help. And this will be on the, you can download this PowerPoint and there's their number. Don't give out your number or personal information, operate anything, if anything free, that's no free lunch. And if they get your Medicare number, it's challenging. So please be aware of scammers. MyMedicare.gov, it's updated their Medicare plan finder this year, and they did it early last year, but it's worth a look. So MyMedicare.gov, they're saying it's a lot easier, which we're finding it to be. Here's when you get into it, here's what you're going to see. You're going to be able to log in or create an account. That's the first thing you ever see if you go to Medicare.gov. So you'll see this hopefully. If not, hover over the Medicare.gov area. You'll be able to click that and it'll come to this page. You can find 2021 health and drug plans, which I'll screen save later. You'll click that, and below that, you'll have log in or get started without logging in. So if you don't want to start an account, you're hesitant to start one more username and password, you can continue without logging in. It's a generic login. You can still work all the way through it, enter all your prescriptions, enter your pharmacies, and you can actually enroll at that point. At that point, they'll ask the government website will ask you for your Medicare number, effective dates, your physical address, your mailing address, other questions, and you can move through it there. It's a wonderful site. If you can get to it and get to adding your prescriptions from then on, or having an account from then on, it's going to save every year's prescriptions. You can edit, review, enroll, compare. It's wonderful. Unfortunately, our office is closed, and unfortunately, we're filled with 1,200 Medicare.gov website of this same prescription drug plans from October 15th through December 7th. So we are booked. We're there at this point. So call Medicare directly, or go through this website, which is a government website. Why enroll? 65 or older. It's insurance that gives good plan coverage. Medicare, original Medicare covers you across the country. If you're someplace else in another state, Medicare original Medicare, which we have, it's going to cover you. If you had an Advantage plan, you're Santa Rosa, for example, and you had a Medicare Advantage plan, and you're up here visiting, it might be out of network and you might not be covered. So definitely check in with us. And you might qualify for free or low cost coverage with extra help or Medicare savings programs. What is a PDP? Do you need one? Of course. And the quick answer is yes, you do need one. Irregardless, if you don't take prescriptions, you're going to want to have a placeholder. As you know, all insurance is gambles, but this will cover you even if it's the lowest cost plan, which fortunately this coming year is a plan that costs $7.20 per month. Then you want to compare what your prescriptions. That's why you want to use the Medicare Plan Finder or the 1-800-Medicare phone number. They're actually 24/7 and they'll answer those questions. You'll give them all the information you would normally give us. And then they would do the comparisons, ask you those questions and give you the answers, and they could enroll you. But you don't want to get penalized from the months you didn't take it, for the years you didn't get one. So just get one. It's great insurance and it can be relatively low cost. And you can always you can't always, but you can get help if you need it, if you're low income or have a challenge or other mitigating circumstances. And these are all approved by the state, approved by Medicare. Again, I keep calling them Part D. You must have Part A or B. You can keep your pharmacist. You can support that local pharmacist. You can check mail order in that plan finder if you're able to go on there yourself. I would always compare mail order. Sometimes it's more expensive, sometimes it's less, but check it. I would always throw in another couple pharmacies near you that might be convenient. I'm not selling CVS, I'm not selling Costco. You don't need to be a member of either. You can walk in the corner, chain link fence entry and the entry, which you never really knew, you might not know. You don't need to be a member to go get food at their food court or pick up prescriptions at the prescription window. I think even their vision eyeglasses is open to anyone walking in, and they're really trying to be helpful. I'm not selling you on them. I'm not selling you on CVS, but they're really trying to get into the healthcare market. You can get the flu shot and you get other services there. Definitely keep your local ones, your Greens, your Rings, your Ponies, your Barnes, whatever's local. If you like them, they love you, you love them. They package your prescriptions. Try them out. Now, you might find when you're comparing all this that they're not a preferred, they're not a standard, they're not in network, but it's something to consider. You might pay a little bit more to keep local. That might be worth it. It might be worth it, to save money in your community. That's up to you. The coverage year is the beginning January 1st, midnight 01 to December 31st, midnight, and then you're covered. Do you need one? I think I might have mentioned it. If you have any of these plans, you don't. That's called or considered credible drug coverage. If you leave any of these plans, you want to make sure with the human resources department before that you're going to have the form that proves you had credible drug coverage, because you're going to need to make a copy. You're going to need to share that with Social Security, with Medicare, to prove that you have that coverage through these programs. So you don't want to get penalized. If yes, you don't have any coverage and you want it. Again, even if you don't have current prescriptions, don't do this to yourself. Get one. You might incur penalties later. And then again, the steps to calling 1-800-Medicare or doing the plan finder online, which I'll get to in a second, list all your prescriptions. You can generally get a list from your pharmacist. You can just ask them, can I get a list of my prescriptions for this past year? You also need the strengths, the dosage, and the regularity. Do you pick it up? Do you use it once a day, twice a day, 3 times a day? Do you use it monthly, an inhaler monthly? Do you use it every 3 months or every 6 months? It's a cream that you might use when you need it, but you don't always need it. So you need it once or twice a year. Well, you can put it on this list of prescriptions If you don't pick it up twice a year, you're just going to save that copay, the second copay. If you do pick it up twice a year, you pick it up more, you're going to incur that copay once or twice more. It's what it is. It's what it is in a positive way, because you're thinking about your future and what coverage you really need. And I'm looking at here because I see movement in the windows, but I'm trying to look at you in the eye, and I'm trying to look at my third screen. So if I seem all over the map, I am. So anyways, of course you can read, you're going to be paying for monthly premium, which could be from $7.20 to $100 a month. Every year it's worth reviewing. You might think that insurance, I love that insurance, I'm never going to leave that insurance. I'm going to impress onto you this thought. No insurance loves you. No insurance company loves you. They love your money. Compare, shop around, be thoughtful, consider yourself first. Why give them money? Again, I'll just stress, they love your money, not you. I want to love you. Compare, talk to us early. So there you go. That's my heartfelt moment. But you can see all the things you're going to pay for. The things like formulary covers. Is that drug covered in that formulary of that plan? Then you might compare another plan and it's covered, and it might help bring the cost down. The copays might be different in different plans. That might compare differently with different pharmacies. There might be restrictions with certain prescriptions that, they're trying to work on the opioid crisis. So they're going to give you only certain ones. There might be step therapies. You try this one, that doesn't work. You'll try this one, that doesn't work. You'll try this one. So there's lots of reasons to compare. And of course, pharmacies and mail order options. I want to tell you, it's important to think of those things. We just talked about all these, so I'm going to work on this PowerPoint probably after this. And of course, how you enroll. We are luckily, since we are registered HICAP counselors, we're lucky we're able to work with you over the phone, and with your participation and your guidance, we can help you work on enrolling in a plan. Our local number for Humboldt County and Delaware County is 1707-444-3000. You can always call the SHIP number, which is State Health Insurance Program. And it's California Health Insurance Counseling and Advocacy Program in California, the HICAP, and it's 1-800-434-0222. If you have any other family members in the state, the wonderful thing about having them call that number, if you can think of people in your family or friends in your circle outside our area, have them call that number. That's going to direct them directly to their local HICAP number. So, well, actually, depending on their area code. So people that lived here for some time, 707, and moved, sometimes you get routed back. So that might bump you around a little bit, but we work on it. We work together really well. So we'll find you the right spot. Of course, Medicare is open 24/7 during this annual enrollment period. So if you're a late bird or early bird or a weekend bird or a turtle or a duck, you can call them 24/7 until December 7th. Weekends, they're open 24/7. So any weekend's going to be less impactful. They're promising their wait time's 5 minutes. That's a government promise. So, it's the one thing about government. I don't want to remember who said this, but watch out. So, initial enrollment period, we talked about that. It's generally the first, 3 months before your birth month, 3 months after your birth month. You want to have encourage anyone to sign up in the first 3 months prior, so that it really gets going. And people can really work through questions and answers and get further information, come back to us. So the earlier the better, reach out to us. We sometimes speak to people a year away, and we're more than happy to give them information. We're more than happy to give them some peace of mind, and then just give them some information and encourage them to call us later. You can see this open enrollment. This all goes back to all the commercials you might see about open enrollment, annual enrollment, lunches, driving, meals, all these different things. Don't worry about that. This open enrollment for Humboldt and Delaware County, which we really care about, which is important up here, is for prescription drug reviews. And again, the last thing, special enrollment periods, they come about when you change plans, when you leave plans, when plans leave you. If you have that in your mind as 2 months away, 3 months away, call us. We'd love to walk you through those steps and work on the paperwork you might need to to get ready for that. You're going to pay the monthly premium, the annual deductible. Generally, it's $435 for all the plans. So you're going to pay, but in the plan comparisons, when you're doing that plan comparison, you'll see when you hit that deductible, then it's going to change costs. And then you're going to get out of that deductible and it's going to change costs after the deductible. Sometimes they're the same, sometimes they change. So you want to double check all that. You'll see the copays when you buy your prescriptions. And the plan finder will literally map out per month where they go up and down. So you'll see that. Any late enrollment penalty, it show you that, and any gaps in coverage. So things not covered, things covered with a quantity limit. So you'll see that in the plan finder. And you can always see if you qualify for help through Social Security's phone number, through Medicare's phone number, or call us and we can see if we can help you with the enrollment. And so sometimes with low income and resources, and low resources are assets, one home, one car. Sometimes you might pay little or no premiums or deductibles and little or no co-payments. So it's important to check. Even if you don't want to take this from somebody else, remember, you paid into this, you deserve it. You've paid into this. This is the system you needed. If you don't need it, you don't need it. But chances are having that money that you can save by qualifying might help you help your family, might help you help your kids, might help you help your grandkids, might help you with your life, might help you get out more often, might help you have lunch with a friend. You are important. Value your life, value yourself, and use resources to better everything. So we're one of those resource area. Agency on Aging is another one. So I'm going to get to questions, but we're supported by grants under the Administration for Aging, United States Department of Health and Human Services, Administration for Community Living, the SHIP grant, the SMP grants, and we're happy that they work with us. So that's the end of my presentation. I think I'm going to stop sharing, and let's see if I could do that. And are there any other questions?
Yeah, there are a couple questions in the chat. One, does it matter under Medicare if providers are in or out of state?
What was that question again?
Does it matter if the provider is in state or not?
No, well, it depends, of course, but no. There's the federal government, Medicare is across all the country. Anyone who sells those plans that they sell you works across it should work across the country. Now, if you're traveling outside the country, you want to check that the Medigap or the supplemental insurance plan has some foreign travel assistance. That's foreign, but they're supposed to, original Medicare is supposed to cover you across the country, and they're not supposed to deny you. The unfortunate thing for Medicare Advantage plans, they're stuck with their in-network. So if they end up at a different hospital, an emergency room, and it's out of network, or likely more than not, the doctor's out of network because he's only contracted with the hospital to see people there, there's going to be all kinds of extra pay. When you're don't hesitate to go to the emergency room or urgent care when you need to, because again, you're the most important person. You matter. But for the most part, if you buy a supplemental insurance policy here in California, it's going to be available across the country. A and B, the original Medicare, it's across the whole country. Alaska, Hawaii, I can't imagine why not Puerto Rico, and our other associated places. So yes. Any other questions?
Yeah, we've looked up drug plans and received different quotes about the allegedly same plan and get different responses when we actually call the company. Who's to be believed?
I would always consider going to Medicare over all those. You can either do a MyMedicare search yourself. It's going to have every plan offered for us. It's going to have every plan that's sold to us, that's offered to us, that works with Humboldt County and Del Norte. So start there, MyMedicare.gov, get yourself an account, enter your prescriptions, and then go further. There's been a lot of glitches with the program this year with pricing. I don't want to name names. Some of them didn't have pricing, some of them didn't have things. Your best bet, if you want a quick turnaround, starting today or anytime soon before December 7th, to call 1-800 directly. You get this, I would say they're not the same personable, but a person, and they're going to walk through your prescriptions. They're going to ask, is this correct? Is this correct? They're going to walk through your pharmacies, is this correct? And they're going to tell you, this is the lowest cost premium and drug cost yearly total. And then you can make that choice to enroll through them right there. Certain agents, if you're talking to agents, they only sell certain plans. So you're not getting the full picture. The other thing is Medicare.gov, try to log in without logging in, you can do that yourself.
The next question, does Medicare have to accept all pre-existing conditions?
Okay, Medicare generally, yes. If you get it when you're retiring, if you get it in that window, initial enrollment period of 7 months, 3 months prior, your birth month, 3 months after, there's A and B covered. Supplemental insurance, so here's the scary part. Supplemental insurance, if you get that supplemental plan during that period, I think it's 8 months after you qualify for Medicare, after you get your car, after you the start date, you have 8 months to get that supplemental insurance policy. Get anything you can. If you don't have retirement, employer group health plan, if you don't have a backup other plan, you want to get a supplement plan. Because if you don't get that in that initial period, you may be denied because of pre-existing conditions. So, then you lose that birthday rule time. You want to get it then. Then your birthday months, like I said, the California birthday rule, your birth date, 11/9 for 60 days times starting now, you could review it with us giving you that direction, with us giving you the resources we have, by you checking those resources I've shared. You can change that without fear of health screening, them looking at your health history. Maybe you were a smoker, maybe you had COPD. Hopefully you got that supplemental plan so you can't be denied in the future. And you can review and change plans during that window without being refused or denied. And then it makes it really hard. Now, some plans, you might go through the whole list looking for anything. I need anything, help me. And some plans might say, sure, but our premium is going to be $300, $400, because for them it's a gamble, and they're the best gamblers around. They are the house. The house always wins. So get in, get early, invest well, invest early, and ride that out. Once you have one, you can change during that time. And we would love to talk to you that birth month, 2 weeks ahead. If your birthday is the 15th, call us the first week. But rather than the open enrollment, it's your birth month that has to do with this. So hopefully that got it. Anything else?
There's one more question. So do Medicare supplement plans cover out-of-network costs when you go to the emergency room or have scheduled surgery, but you haven't been informed that they're using out-of-network docs? So I guess if you don't know it's an out-of-network doc that you've been,
no, you don't always know. You don't always know. And in a crisis moment, an acute issue, you go period. You might get weird bills later, and you're gonna be, going, what the heck? But it's what it is. It's really what it is. Medicare is going to cover the best of it, the 80%. Supplements hopefully going to cover the rest. But honestly, their game is money too. So all the doctors, all the insurance companies, all the hospitals, they're, again, they're in it for their pinch of the pie. And so that all comes later. When you talk about in-network, out-of-network, preferred or standard, we can really dive into it more with prescription plans. But it's really hard to foresee what things are going to cost and where those costs are going to be billed from. They're not always going to be billed from the hospital you go to. You might be billed from the out-of-network person that came in and talked to you, or the private company that does EKG readings, or the people that look at X-rays in Arizona. Emergency rooms are different, and I don't want to answer that right now. I don't think I can fairly and efficiently.
So there's another question. Can supplemental plans charge more for pre-existing conditions during the initial enrollment period?
No, because they're not pre-screened. They're signing up clean. They're a clean slate. They got a golden ribbon wrapped around themselves, and they're brand new. So they get a guaranteed right to a supplemental plan for those months, for that supplemental plan. Hopefully that was in my new to Medicare window slide. But yeah, for those months, they're guaranteed right to enroll. Sign up, sign as soon as you can, the day you can, get in there, because people get excited because, oh, I'm done with it, I'm done with it, and then they forget. You're not done until the cockatoo sings and they mostly squawk. So follow your own window, get it done, started early.
Sorry, there's another question. We see all these commercials on TV for Medicare Advantage plans. They aren't any available locally, are there? I know.
No.
I mean, talk about Joe Namath, because I was actually
No.
my question, right? No.
No, none of that. I mean, as much as I enjoy Wheel of Fortune and Jeopardy, mute. None of those commercials. I'm gonna, they're really pushing insurance companies selling us those things. It's all for profit. All those are insurance companies selling those things. They're going to pinch the pie by either denying you coverage or stretching it out, or somebody passes away over here, so they save money over there, so they can make their $30 billion in profit and then advertise. None of that's available in Humboldt County and Del Norte County and 7 other small counties in the state. So just ignore them. Please don't call us. We will make the biggest stink. You will smell it far and wide. And you'll be excited that it's not a skunk if that ever comes back. But honestly, you have to compare the costs with original Medicare. If you're 145 with the Part B every month, the prescription premium might be 30 plus prescription drugs, might 30 to 50. So round it up to 50, 75 per month. Then you got your supplement plan. So it might start at 100, 150. So that's the whole A, B, D, and a supplement. What's that cost? And then compare it to a negotiated Medicare Advantage plan. And they might seem cheaper, they might sound cheaper, but then you're hit. If you're visiting Humboldt County, we're not in their network. So you're gonna pay more here. You're gonna get hit with the higher cost. So it might sound fancy somewhere else. And it might sound, they might include dental and vision and hearing, which you can pay for. They're not covered in general Medicare, but they would be a supplemental plan you look for, or you purchase it extra, but they're not available. So please ignore them. Please don't call us about them.
All right. Anybody have any more questions for Ben?
Hey, Ben, this has been fantastic. That's more information than I suspect anybody has heard about this in one place for forever. So it's wonderful, because we're in the process, of course, of reviewing all these plans. And that's why I asked a couple of these questions, because we've had the dilemma of who to believe when you get different quotes at different times when you contact websites or you contact the company itself and say, hey, what's the deal? And one says something is covered and the other said, no, it's not covered, but it's the same company. What do we do? That's why I asked that question.
I agree, Jane. I wholeheartedly agree. When I assumed the registered counselor, I had a ramp up of new vocabulary information. I never had a clue how complicated and complex and confusing this would be. But the counselors here are unbelievable. We probably have 50 or 60 years, 50 years of shared knowledge. And I hope we have many more years. And we constantly, this is a group I would say encourage, if you're looking to volunteer, or you want to keep your brains busy and learn, we're always looking for volunteer HICAP counselors. And people love it. Teachers love it. People that have worked in the medical situation, people that just want to share and teach. So we look forward to that. And yes, I would encourage everybody to set up a MyMedicare.gov account. If you're using a computer, you're already halfway there. If you can check your email and log into a site, you're 2/3 there. So set it up. It'll be there. If you ever ask us for help with that in the future, I don't understand what's going on. I don't know what happens. I got a Medicare summary notice. I don't understand it. Well, we can log in together. You can give us permission. We can log in with you. Or you could share your screen with us if you're savvy enough to do that. And we can see and read what you're seeing and reading. And we can really help you through the weeds. I just fixed my weed eater. I think everyone's got a good weed eater. So don't worry about the weeds unless it's native or local fauna and flora. We won't touch that. but the rest of it, we'd love to get through.
Well, Ben, thank you ever so much. Any other questions? Yeah, this has been fabulous. We really appreciate it. And you've done a great job of explaining it, giving us lots of resources we can access, and I'm sure we will be doing so.